The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon, good morning, wherever you are today. My name is Chantal Stevens with the Community Indicators Consortium, and it is my pleasure today to welcome you to this webinar, City Types and the Drivers of Health. We hear a lot about big cities issues, but not so much about small and mid-sized cities with their specific issues, particularly around social and health issues. If you are trying to measure, track well-being and quality of life in those smaller cities, this should be an important information for you. So now, to tell you more about it, we have Becky Ofrane and Neil Kleiman. Becky?
Hi, I'm Neil Kleiman. I'll introduce myself first. I have a joint appointment at the NYU School, Wagner School of Public Service, and at our Urban Data School, the Center for Urban Science and Progress. And Becky?
Hi, I'm Becky Ofrane. I'm the Manager of Engagement and Partnerships for the City Health Dashboard, and I'll pick up where Neil leaves off in a little bit here. Go ahead, Neil.
Excellent. And I think, as you can already tell, this is a partnership effort given the multi-disciplines that we're bringing to this project that has been supported by the Robert Wood Johnson Foundation. And I think also signals that Robert Wood Johnson Foundation has become far more committed to community indicators, to cities, to data, and of course to health. So I'll go to the next slide. And talk about what our objectives are for today's webinar, as you can see, which is we have a few of them. So we have a lot to get to, but we're going to try and end early so we can get questions from you. And our primary objective is to talk about the findings from a report that we just issued recently. That's a framework for better understanding health data at the local level, particularly in small and mid-sized cities. And then we also want to talk about various tools and interactive features that we have been developing for you and for the work that you're doing, even beyond the new report that we issued. So I'm going to go to the next slide. And just start off by saying that the main thing that we do is maintain open data website called cityhealthdashboard.com. So please don't go there now, but we just wanted you to know that that's our flagship or signature initiative in which we consistently track 35 measures of health at the municipal level for 766 cities across the United States. And this is the only place where you can compare city level data. There's a lot of county and state level data around health. And we will talk more about the City Health Dashboard, but today's conversation is more about a report that we just issued. On the next slide. So yes, so here you see the nicely designed front cover of the report. And if you haven't taken a look at it, please, after the webinar, take a look and download it. And this was really a report that we put together as part of our dashboard effort in which we focus on health issues at the city level. And one of the reasons we do this is, as many of you probably know, America is a nation of cities. And it's not a nation of big cities, it's a nation of small and medium-sized cities, which this report focuses on. So in a country like China, there are 662 cities with populations of 1 million or more. And in the United States, we only have 10 such cities. But yet we have so many small and mid-sized cities. So this report focused squarely on the 719 municipalities across America that have population sizes between 50,000 and 500,000. And our goal here was to say, how can you possibly make sense of 719 locales, especially when researchers and scholars and even data scientists in the United States are not accustomed to focusing on these small and mid-sized places. So our approach with this report was to create a typology or a set of categories just to get our arms around the 719 small and mid-sized locales around the country. And so we wanted to create clusters, or essentially 10 distinct city types, for us to better make sense of what those trends are, with the goal of having better policy responses around health, which of course we're all focusing on right now. So I'm going to go to the next slide. And so before even getting into the specifics of our typology, I think it's worth remembering why cities are so important when talking about health. And obviously this is right in front of us every day, dealing with the pandemic. And of course, cities have such an important role to play in terms of responding to COVID. Everything from access to healthcare, to face mask regulations, to coordinating various first responders and health facilities. But cities are also primarily responsible for both funding and managing and holding accountable those providing services that we might think of as the social determinants of health, those upstream dynamics and characteristics that truly affect a person's health, whether that be housing, whether that be criminal justice and safety issues, and of course, creating access to healthcare, not to mention all of the range of issues having to do with education at the K through 12 and at the higher education level. So cities are critical. It's, I think, impossible to talk about health and improving health and responding to health crises, whether it be COVID or the opioid epidemic, without talking about local government and local communities. The next slide. So here you see the 10 distinct types, or the typologies, that we have in the report. This is really the heart of what we did in this effort, where we did a cluster analysis looking at demographic, economic, employment, and other data points to see where there was commonality amongst the 719 cities that we looked at. So if you look at the right-hand column at the top, as just an example, this is a category called Latino predominant enclaves, of which there are 46 such small and mid-sized cities around the country. And these are lower income cities in smaller metro areas with large Hispanic and Latino populations. And as you see from the map, these tend to be areas that really bunch up around the country. And there are a number of fascinating, important cities there, including Riverside, California, and also Allentown in Pennsylvania. And then the next category type down are what we call working towns. So these tend to be middle income communities in smaller areas where a lot of the residents work locally, as opposed to having to commute for work. And there you see the number of working towns across the United States is far more spread out. And you have cities like Colorado Springs in Colorado, Des Moines and Scranton in Pennsylvania. And then the next one down as an example are regional hubs. And I find these utterly fascinating. We refer to them as micropolitans. So these tend to be the economic powerhouses or generators in small areas that are creating lots of jobs, even for the surrounding areas, and people tend to commute into them. So this includes places like Akron in Ohio and Baton Rouge in Louisiana. And again, you can see on the map that you have a lot of bunching up in terms of where these locales are located in the United States. So I'm gonna go to the next slide. So here's where we talk about what are the common threads or themes that we've seen across the 719 cities. And I'm not going to get into it here, but there's this fascinating graph we call box plots that's in the document. And the box plots helped us to identify what those common themes are. And clearly, and this is not a surprise to really anyone that's looking at data and doing research, one of the biggest takeaways here is that health outcomes track very closely with socioeconomic disparities. Another finding that was somewhat surprising is the big city proximity helps, meaning that the closer you are to a big city or a micropolitan city, the better your health outcomes will be. The next interesting finding is that there are almost no middle income types. So the issue of equity or inequity around the country that we read so much about really plays out across the country. So it's not just within major metro areas like New York City or San Francisco, where you have an extremely small population that deals with that has most of the wealth, and then a large low-income population. This is the dynamic you see everywhere. And we see that poverty, rent burden, income inequality. So these are more specifics on the stats in terms of the commonality of poverty and rent burden rising. So poverty rose from 12.8 to 5.6% amongst all the cities, and the rent burden increased from 41 to 52% across the board. Next slide. So here we get at recommendations. So given that we spent all this time looking at small to mid-sized cities and health issues, we have some suggestions for policymakers, both at the local level and at the national level. And these are very much applicable to government leaders, philanthropy, universities, and of course, researchers. So number one, not so surprising, equity has to be addressed head on everywhere in the United States, particularly in these small and mid-sized cities. Number two is cities need a lot more authority. We can talk more about this, but increasingly, city authority is being taken away through measures like preemption. And you're seeing this a lot in the pandemic, where local governments are not allowed to even pass their own face mask ordinances. But that's just one example. There are many others in which local governments are in a better position and local communities are in a better position to have responsibility and authority for their own health and related measures. And the last recommendation, and this is where a webinar like this is so important, is there's so much that can be gained from peer cities working with each other. So clearly, to the degree cities within similar typologies can work together, can advocate with one another, and can learn from one another will be tremendous. And we're trying to foster that on our City Health Dashboard site, and we're hoping to see more of that. Next slide. So this is something that's in the report and that we maintain on the City Health Dashboard, which is to have a COVID risk index, so that somebody can quickly look and see how extreme the negative impacts and infection rates and related conditions will be of COVID in your local area. And so we did this according to the typology as well, and we saw tremendous variation across the board. So if you see at the top, the small, stable size cities have a COVID risk index of 2.6, not so bad, but it's terrible in small industrial legacy cities where it's 9.7 and at a much higher rate. So do take a look on our site and in the report at the COVID index, and I will now pass the baton over to Becky for the rest of the presentation.
Great, thanks, Neil. So because we have a lot of people here, I'm guessing, who are very interested in the data, we'll look at some specific measures that are useful in understanding the typology more fully and how you can put it into practice locally. So I just wanted to show this list of the measures that fed into the typology, in case you're familiar with typology methodologies. This is in the technical appendix of the report, and we just wanted to show it here. So you had a sense of what formed those 10 city types. And there was some weighting involved of some of the different measures, and we used latent profile analysis, and that's about the extent of me and Neil's knowledge on the technical aspects of it. And we're happy to put you in touch with the researcher who kind of got into these nitty-gritty details, but I just want to make sure we gave you a sense of what went into that there. and why we describe the 10 city types in the ways that we do. So once you have the 10 city types, you can analyze a variety of health and socioeconomic measures by city type. We looked at these measures listed here because we wanted national data sets that were available for most or all of the 719 cities. And what we define small and mid-sized cities as 50,000 to 500,000. And these are the measures that were available from ACS and some other sources that really covered most of that set. We also looked at cardiovascular disease mortality data, which is only available for a subset of the cities. So we didn't publish that as part of the report, but we plan to continue this analysis as we get this mortality data for smaller cities. And you may have access to many more local indicators of well-being in your community. And we focused on these because of their availability across the country, thanks to standardized data collection and modeling. This allows us as researchers to compare across cities, apples to apples, and to draw conclusions. And we acknowledge that there are other local data sets that you may be able to use as well. And I'll ask you to begin thinking about those for us to potentially share with each other in a couple of moments. But in the meantime, to help put this into practice in your city, we've added some ways to explore the city types and related health data to the City Health Dashboard. I'm actually just going to switch to the website here real quick. Okay. So in general, our new city types page, which is cityhealthdashboard.com/citytypes, is your home base for the report and exploring the findings. You can download the report and fact sheet, see an overview of the findings, and download a list of all of the cities and their city type if you want to do further analysis by city type. This is also, as you scroll down, where you can find the City Types Data Explorer, where you can view the measures used in the analysis that I just showed that previous list of, such as poverty, life expectancy, and homicide rates. And just to orient you a little bit, Neil mentioned earlier the box plots in the report. This is essentially an interactive version of those box plots that you can kind of rebuild on your own. So to orient you here, each dot is a city, and they are grouped by the 10 city types. And as you hover over, you can see each city and its value for the selected measure. Right now, we're looking at poverty rate. So staying on poverty rate, you can search for a city also. So I'll just select Shreveport here, which you can see falls into the regional hub and has a poverty value of 25.7%. And just at a quick glance, what you're seeing here is that is over this median line for all regional hub cities. This is the box plot that we were talking about. And it's also greater than the median for all small and mid-sized cities, which is down here at the bottom of the chart at 21.9%. You can also use this to explore within your city type those peers that we mentioned. So you can hover over, cities in that type that have lower poverty rates to discover potential peer cities with better poverty outcomes. And now that we know from the city types framework that these cities have comparable social, demographic, and economic characteristics that might help guide some solutions around poverty in Shreveport, which is a driver for so many other well-being outcomes. So just coming back to the slides, I wanted to dive into two of those city types a little bit more, kind of showing some of the things that you can discover using that data explorer and the data there. And I'll just look at regional hubs and emerging cities quickly. Regional hubs, as Neil described, I also am really drawn to this city type. And two of the cities that we consulted with throughout this process fell into the city type also, so I had a little more working knowledge of them. But this is where there's a lot of inequality. Black households earned 46% less than their white counterparts across these cities, and that wage gap has been increasing. A quarter of residents in these cities live below the federal poverty line, and rent burden has been increasing since 2000. looking at emerging cities, these are small but really fast-growing suburban cities across the country. They had the largest population increase of all the city types. Less than 10% of residents live in poverty here, and the average life expectancy is 4 years longer than it was in the regional hub cities. And looking at rent burden in these places, they had the most variation and change in rent burden, with some cities seeing a decrease, as you can see here, a couple of the cities, and some increasing as much as 25 or 30% from 2000 to 2017. So just some really interesting things that you can find in comparing the different cities. We have also incorporated some new features related to city types within the City Health Dashboard. And I think because we're doing okay on time, I will also go back to the website for this. So from the city types page, you can just hit the logo at the top to get into the regular City Health Dashboard. And as Neil mentioned, and for those new to the dashboard, it's a free online resource featuring important measures of health, as well as the factors that shape health. We have over 35 measures for over 750 cities of populations 50,000 and larger. And you start just by diving into a city. I'll look at Kalamazoo today. That was also one of the cities we worked with on the City Types project. So once you select your city, you can select individual measures like our new COVID local risk index. You can look at life expectancy, neighborhood walkability, and today I'll select uninsured rate. And the dashboard contains data from national data sources parsed to the local city and census tract boundaries. So you can, again, compare apples to apples between neighborhoods and across cities. And as Neil mentioned, there's a lot of health data at the state level, the county level, and we really wanted to provide a tool for local policymakers to understand within their municipal boundaries what they had control over. And we try and only put measures on the site that are amenable to local change. So here we see Kalamazoo's value for uninsured residents in 2018 was 8.1%, which is better than the average of all dashboard cities, which is all cities 50,000 and larger, and that average is shown here at 11%. Note that across the site, lighter colors indicate better outcomes, and you'll see that color shading as we continue to go through. As you scroll down, the city map shows values by neighborhood or census tract. And this is really valuable in identifying gaps and disparities within the city. In Kalamazoo, we see this neighborhood on the north side has an uninsured rate of about 3.1%, very close to these neighborhoods with dark shading. This one here at 14.6%. I'm going to jump forward to this Compare Cities tab here because this has a new feature that's relevant to the city types. Here is where you can find other cities to compare on your selected measure. We're still looking at uninsured. So you can find cities that you tend to compare yourself to for whatever reason, and that will show up down here. You can also filter now by city type. So Kalamazoo fell into the college city type, which brings up all of the other peer cities there. And can show you some cities that you might not otherwise have considered peers, maybe because they were in a different state or a different region. So we hope these tools help bring to life the city types and the findings we have shared with you today, all with the goal of helping you uncover important levers for change to improve health and equity. And we'll just go back to the slides here. So we hope that this has sparked some new ways of thinking about your city. We will open it now for questions and discussion, and we're happy to take questions on the dashboard and on the city types, but we also know that you are the experts of your community's challenges. So we'd like to use some of this time for you to share with each other opportunities, local policies, interventions, and the data sets that you use that to address these drivers of health and well-being. So I will pause here. check out the questions.
Thank you, Becky. Thank you for that, and Neil, very very thorough, very interesting. One observation that comes from your presentation is that community indicator project often like to compare themselves. They definitely almost always compare themselves against time, so a suite of numbers over time. But quite often they will look for ways to compare themselves geographically, and quite often they will do a larger geography. So if they're a city, they will compare themselves to county numbers or to state or national numbers and whatnot. It occurs to me, listening to this, that this would make it very convenient to find peer cities. And one of the issues that what you hear from community indicators practitioners is that, well, yeah, I would like to compare myself to another city, but this is, how do I know? Somebody will always jump in and say, well, yeah, but that city is different because. So it seems like you're offering a fairly great methodology here to identify cities within your city type, so that you can compare yourself to that. I guess the question that would come out of that, do you see any danger in doing that? And the response that would be yes, but this is, this city is in, on the East Coast and we're on the West Coast. So they don't know, they don't have the same problem. We have a big plant that just closed and they didn't and whatnot. I'm not sure if there is anything you can say, but if you could expand a little bit on that, that would be useful. While we're looking for questions and comments at the same time.
Sure, I can start there. So, the any typology framework, it's more of an art than a science, and in generating the different city types, there will always be outliers that don't exactly match, but we've let the sort of numbers speak for themselves in that sorting process. Each city falls into only one type, and as we were doing this process, it was both a quantitative and a qualitative project, and we had an advisory committee of kind of city thinkers and researchers, but also with city leaders from different small and mid-sized cities across the country. And we went through multiple iterations in working with them to identify the city types. And sometimes they would look at it and say, yes, this description really does identify who we are, and there's a number of other cities in this type that we do compare ourselves to. And then sometimes there were ones where there wasn't quite as strong of a connection. And I think you'll always be able to find the differences between cities. Every place has a different history, different current economic conditions, demographic makeup. So that always has to be taken into account. But if this allows cities to find some of those peers that they wouldn't normally think of, then we're really thrilled that they can build those connections and find some solutions that might be working in other places. Neil, do you have anything to add on that?
Yeah, I have to say, I've been working in networks for about 20 years, and I've never found anything more powerful from a learning perspective than when local leaders can come together. There's a lot you can do, obviously, on your own, but man, the creativity just explodes when people meet with each other, and it's almost like group therapy in a way, even if there are some differences. And we've started talking to different cities and community leaders around the country, and one of the first things they do is they take the report and they immediately look at the back to see what are the other sort of cities in their cluster, and they say, wow, we've been looking for this for a long time. Like, it sounds kind of strange, but I can't tell you how many times I've met with cities over the last 7 years, 8 years, 10 years, and they've said, we're in this kind of interesting dynamic where we're a college town, but yet there's a lot of poverty here, and no one seems to kind of get that, right? Or we've talked to a lot of cities that say, we're a really city that has a lot of poverty and unemployment, but we're the biggest employer. We are. We like power the whole region. Who would ever think that, right? Like a Baton Rouge or an Akron or what have you, they are. They're the engine that powers the region, but yet the poverty and unemployment is off the charts, and they're just like yearning to have conversations with other people. So even having that ability of taking a look at the list of the back of the report and reaching out to some of those other cities to see what it is that they're grappling with, I think has tremendous possibilities in terms of both learning, but also just having colleagues or friends who you can talk to and say, look, this is what we're going through. What are you going through? And even to your point before, Chantel, about what some of the differences are, that can still be kind of useful, right? Like one of the biggest kind of dividers that we find in the health field is the difference between those places where the municipal boundaries are coterminous with the county boundaries or not. Meaning, are you a city where you're also a county? So in a place like San Francisco or New York City, there is no county, it's one and the same, which means that the local government has jurisdiction over health issues, which is the opposite of a place like Atlanta, where I believe it's 4 different counties intersect within the municipality of Atlanta, which says nothing about the state capital also being there and all the power they're stripping away from the local government. So you might say, like, what can Atlanta learn from a place like a New York City? A lot, right? Because then you sort of see like, oh, I didn't realize that you could actually advocate for this, or that's even possible. Or now I'm going to go back to my 2 or 3 county supervisors because I realize in New York you have the authority to do X, Y, and Z. So I think there's just so much that can be learned from a comparative perspective. And one of the things that I think is one of the biggest shortcomings and opportunities in this country is that we really are a cauldron of innovation. And we are because we live in a country that's a federalist country, meaning that whatever the current president might say, local governments have a lot of authority in America compared to other industrialized nations. And there's a massive amount of creativity going on. There's also a massive amount of struggle. And we only get better by learning from each other. And despite the power of the internet, there's far less of that than should be happening. And if you get one thing from this report, it is the fact that there are a lot of similarities and also differences that we can learn from each other, and let's start making those connections.
I see one question. It seems like we have a very relaxed audience who is probably very busy on other issues as well. Somebody asked about the neutral role, but I'm not sure if you understand that question. I'm sorry, there's a lot more to that. As researcher, what role do you typically take with political? Well, you can read it as well, but as researcher, what role do you typically take with political leaders, jurisdictions? Do you act as a facilitator for collaboration between regions, or do you take a more neutral role?
That's a good question, and I think we are absolutely very nonpartisan, and I think to the degree that we have an opinion and have a stance, it is that we are in support of local authority. And some of this is based on the data and the research that we've looked at that says that there's some great work by someone named Michael Pagano, who is a scholar looking at intergovernmental relations at the University of Illinois in Chicago. And he and others have shown that the more authority and autonomy localities have, the better they are able to manage their budget and their finances, meaning that you have less bankruptcies, right? And also that health indicators are greater in localities that have more authority and responsibility. And the more that that authority is stripped and taken away, the lower the indicators are for health outcomes, for budgetary fiscal balance outcomes, for economic outcomes. So I think we don't even say this like publicly, but to the degree we have a position, it is to try and create more support especially from a data perspective, for local governments and for communities to make decisions. And one of the things that we've seen that we're starting to get more involved in, again, is that there is a growing trend to strip power away from localities. And one of the things that I think there's a tremendous amount of ignorance of in this country is that the federal government really has very little to zero authority over local governments and communities. And those that the entity that does is state government, and that's codified by Supreme Court decisions. So cities are really, truly creatures of their states. And you would know this if you ask any mayor, that says to the degree they have to look both ways before they make a decision, before they raise a tax, before they do anything around health issues, it has to do with those state authorities, whether agencies or at the gubernatorial level. So that's a very long way of saying that we do not take political positions. We work a lot with Republicans and Democrats. I myself have written a lot about these issues and co-wrote it with Stephen Goldsmith, who's a former Republican mayor of Indianapolis and a great leader in the Midwest. But we are trying to be active at the local level to provide as much support at that local level in relation to health issues. And I think that has to do a lot with this work coming from a school of population health at New York University. But Becky, I don't know if you would add anything to that.
No, just thinking about the question in terms of, you know, connecting cities, and we do some work on that, but we are also somewhat neutral in it. And we are working on kind of, you know, building local capacity across cities and looking for more opportunities to do that. But we do partner with other organizations like CIC, NLC, National League of Cities, ICMA, National Resource Network, to really connect with those local places and bring them together.
Neil, would you mind maybe writing in the chat box the name of the researcher you just mentioned? I find that area fascinating. I think we suspect that is the case, but I would love to see the research that shows the link between the independence of a city and the health, the health indicators in that city.
I will write it in. And a lot of his work has been featured as well in partnerships that he's taken with the National League of Cities and with the Metro Sector at Brookings.
Yeah, thank you. So we have another.
I will just mention in the.
Oh.
Sorry, I will just mention in the chat. We can't see if other people are putting stuff in, so you'll have to just keep going with if there's any questions.
Okay. So we just get another question, which is many of the cities are large suburbs of. Oh, that's actually a question I was wondering myself. Many of the cities on this list are large suburbs of mid-sized regional hubs. How should we think about these, and are sister suburbs best compared to each other, or can the comparison be extended to other metros?
Can you read
Can you say that
the
question again?
with it?
So many of the cities on this list are large suburbs of mid-sized regional hubs. How should we think about these, and are sister suburbs best compared to each other, or can the comparison be extended to other metro areas?
So it sounds as though the question is asking, to what degree is there commonality amongst cities that are suburbs, essentially?
Yeah, whether you should compare them to each other, or whether it's fine to compare one suburb of a mid-sized city to another one, you know, maybe on a different coast or a different state or whatnot. I think that's what is being asked.
Right, and it's interesting. I don't believe that we have made the distinction between what you might think of as core cities and suburb cities. I mean, really the primary distinction is that these are municipalities, and obviously in some ways these are somewhat arbitrary and artificial or legacy municipal distinctions, but municipalities with populations of 50,000 or more. And so I think that question can be a little tricky because a lot of suburbs might not meet that population threshold, even though there's 719 of such places. There are many, many more that aren't counted. Many suburbs or places that are thought of as suburbs are unincorporated locations. We clearly did not capture those. So that's a long way of saying, and Becky might want to weigh in as well, that like to the degree one wants to have a particular focus on suburban cities, I'm not sure if we're quite as precise as one would want. Although clearly a number of suburban cities are captured in the typology.
Yeah, and just to the point of metro areas, you know, a lot of studies that look at kind of cities, also they use like an entire metro area. And as Neil mentioned, you know, we have Atlanta as a city, but also those places that would make up the suburbs of Atlanta and be considered part of the Atlanta metro area are distinct municipalities with their own governance. And so we include those as separate cities. So if it's kind of a smaller city that you might consider a suburb of somewhere else, it has been included as its own unique place.
Great. Well, thank you. I had another question, and that relates to the COVID risk index. I find that you know, I think everybody is trying very hard to adjust to the new, I won't call it the new normal, but the new situation, and provide as much as information as possible. I'm wondering to what extent this, well, first, if you can speak a little bit more about, I suspect what some of the indicators might be that were combined to get to that index, but maybe if you can mention that a little bit more, and then see to what extent could someone, you know, just grab this and put that number on their website if they see these listed as part of it.
I mean, I think on some level, if a city sees it, that they're on there and that they grab it and put it on their website, I think we would think that's a good thing. I mean, I think what we wanted to do with this is to ring the alarm to some degree, where there are cities that have large populations that are particularly susceptible to the COVID outbreak. And there are very specific.
And I'm sorry, if I can interrupt you just a second there. What is the scale? So is there a scale of 1 to 10? Now, what is bad? What is good? What is, I saw some cities in the 2 area, yeah, and others in the 9 area. How does that work first?
Becky, do you want to say more about the scale and what it constitutes the risk factors?
Sure, yeah, it's a scale from 1 to 10, 1 being low COVID risk, 10 being high COVID risk, and it takes into account, so it's the bulk of the index is made up of the CDC's Social Vulnerability Index, the SVI. A lot of people might be familiar with that. But we also added in some additional health outcomes measures. So the SVI, if you are or are not familiar with it, it's social vulnerability to for a number of different issues. It could be natural disasters, pandemics. So there's some pieces of it, some measures that go into the SVI that are not as relevant to COVID. So we added in a couple of health outcomes and additional demographic factors that have been shown to be linked to COVID. So it is our own calculation from 1 to 10. And the way that it's shown on the City Health dashboard, if you go and just find your city and go to the COVID local risk index, you'll get a city score from 1 to 10, but you'll also be able to see the score by neighborhoods. And one of the most interesting pieces of kind of looking at the COVID local risk index is the variation between neighborhoods in a given city. Some cities have census tracts with a risk of 1, and then another census tract nearby at a risk of 9 or 10. And so understanding how the neighborhoods fall, and what we're looking at in that risk index is risk of transmission and severity of if people contract COVID. It does not take into account current case counts or anything like that. It's just looking at those different vulnerability factors, kind of health and demographic factors of the population, and predicting what the transmission and severity might be if people contracted it. And some cities have used that to help identify where they should be putting testing sites in the city, and using it to Waco, Texas is using it to develop their kind of citywide strategy in addressing COVID. So there are a lot of different ways to use that, and we would be happy for people to use that index. I didn't mention that, all of the dashboard data is also downloadable and available by an API. We don't have the COVID local risk index currently in that downloadable data set because the science is changing so quickly around it. So, but you'll see a note there in the downloadable data section of the City Health Dashboard that if you just email us, we're happy to send it to you. So that's a little bit more on the COVID local risk index.
And just to say, one of the points of having the risk index, which kind of goes back to the fundamental point of this entire project and of what we're doing with the dashboard, is to call more attention to the small and mid-sized cities in the United States of America, which we rarely ever discuss in this country, right? So I tend to see this as this like incredibly bifurcated policy conversation where there's so much debate about places like San Francisco, Seattle, and New York because they're just big places, right? And there are a lot of media outlets there, so we talk about them. And then, as you notice, in a time of a presidential election, we talk about just those few communities that have those precious few thousand votes that will determine the election that we talk about as well. Allentown, Pennsylvania, Scranton, Pennsylvania, Akron, Ohio, right? They get a lot of coverage. But geez, we almost never talk about places like Fall River, Massachusetts, Waco, Texas, as Becky mentioned, Salinas, California, Compton, California. These are places that are, again, the engine of our economy, the places where the vast majority of Americans live, and we do not talk about the policy issues, the health issues that are taking place in these communities. And so what we've done with the dashboard website, but particularly with this report, is to really shine a bright light on what is going on in these places and how can we begin to make sense of the common features and characteristics so that we can have a policy response. And we stress over and over, there is no better response than one that comes from the community level. And that's why we were really enthusiastic and so glad to do this webinar and have this conversation with you. And if there's any way that we can keep engaging with your members about these community indicators, we need to work together, right? On both the research side, the policy side, the community advocacy side, and the community data side, because we have to call attention to the places where people live in this country and the types of policies that we need to see.
Just maybe if you could just, and I don't see any other questions, so we probably can bring this to a close. But maybe we could put back on the screen your contact information for just a moment at the end. I think you gave us a lot to think about, so it would be great to be able to get back to you on some of those. Also, feel free to send questions. We know that quite a few of you will be watching this after the fact and may not have a chance to ask questions directly. If that's the case, don't hesitate to contact CIC at ed@communityindicators.net, or you can hopefully just email Becky or Neil about some of your questions or some ideas that you may have for collaboration or coordination or whatnot. So thank you very much for spending this time with us. Thank you, Becky and Neil, very, very much for putting this together and taking the time to come and share that with our audience today. Have a wonderful day. Thank you very much, and let's keep in touch.
Sounds good, please. Thank you.
Okay, thank you, Chantal.